Welcome to Mastering and Guideline in Ultrasound and Echo. Hi everyone. In this case study 12, we have two case studies. Beside of the main question here, I'm going to ask some question too on each of those clip. So you have to answer beside of these questions, answer to those questions too. Here we have first case, a 69-year-old man with cardiac arrest. They brought it to the hospital. They did CPR for a few minutes and patient admitted to the ICU. Patient had 4 days ago TAVR because of aortic stenosis. In ICU, patient has been stabilized and put intubated and connected to the ventilator, blood pressure, hypotension, and echo requested, and we did echo on this patient. Based on all those clips I am going to show you and image Doppler study, answer to this following question. How much eyeball guessing for EF? Is that any coronary artery disorder? Yes or not? Which one? And give everything that you know about the MI on this patient. What is your next step on this study has been done? Imagine this study has been done completely and you are there. What should you do? Now let's go to the next clip. Here, as you notice, patient has poor window in both of those case study. When you are dealing with the patient intubated ICU and they have already many problem, you will not expect to have clear good images. Many times like this. This is at the level of the aortic of access, low access of the plaques, as you can see, and the aorta and a little mitral valve here. You can see color Doppler. Question on this clip. Are you judged based on this movement, on this view? Low access apical or plaques, low access plaques or high access apical tree. Are you going to judge based on this? If somebody asks, okay, how much give ejection fraction based on this? Are you giving any, is conclusive or not? Here is color Doppler on the aortic valve, you can see. Next. Here the patient had the good window on subcostal. This is subcostal window, so you can see very clear. Now you can guess how much ejection fraction better, I think, in this case. Okay, now let's, here we twist, sweep it, see around there is not any fluid or not. You can see an aortic valve, you can see here a little. Next. Here, do we do Simpson on this subcostal? You saw it. Can we do Simpson on this based on those images you saw? If not, go back and see if it's the can we do it Simpson or not. Here the same patient, apical tree almost. You can see poor window, but still you can see some stuff. And cursor, we put it there for the continuous. We got continuous this one. What do you think? Here subcostal color, you can see color jet there. Even if off axis, you can see more than 20%, but still we see some jet there. But we continuous, we get this even with increasing gain, everything. It doesn't show any Doppler, just some stuff. Again with a little heel toe and make it parallel. Almost we have jet and almost acceptable angle of the cursor with the LVOT and aorta, and we get this time. Some stuff Doppler here, some Doppler here. Do we rely on this and measure it or not? Okay, I think we got this one we do LVOT. The amount is stroke volume acceptable measurement, but even we are close, you can see the click on the valve. We are very close, but still at least we got some LVOT and stroke volume measurement. The LVOT was on this patient was 2 point, I think 2.1 or 2.2. Here, zoom on that apical 5 and subcostal, you can see. Do you see any suspicious finding on this color Doppler? Just focus a few minutes if you can do. Pause it, go back and forth. Let me see how much your eye observation is very great. And this is the final image on this patient. Again, on this, you can see calcification, aortic valve is apical, not a subcostal 5 chamber. Let me put it this way. You can see a little calcification, valve, a little jet here. You don't see anything beyond that. Do you see any abnormal finding on this? That's make you very suspicious to do something. There is something is going on this patient. Here we have second patient, case study 2. We have a 72-year-old man with chest pain, pressure, and shortness of breath. Patient came to the hospital, admitted, and based on the finding, background, and all those stuff, patient took to the cath lab and they did angiography. They found two blockage, 70 and 80%. They put the stent and they sent to the floor, request echo because they hear some murmur. We did echo on this patient. Look at these plaques and other clips I am going to show you answer to this question, and at each of those clips maybe I ask some question, answer to those too. Here you have good plaques, acceptable, you can judge based on those stuff. This one color on the aortic valve. What finding you see on this clip on the color Doppler on the aorta? Here on the short axis of this patient, you can see aorta a little visible, and that's it. Next one. Here we did M-mode, color M-mode on that short axis of aorta. What finding on positive finding you see on this color M-mode? Next, here a little more view, better view. What findings on this case you can see on this short axis findings, and what should you do on this image, specific on this image? And if you can answer to this question, what is this wedge shape here when show up in specific moment here? What is this? And give me two finding beside of the not opening aortic valve, especially these two cusp, left and non-coronary cusp doesn't open well. What those are finding? And next. Here apical 3, almost cursor parallel to the jet of the LVOT and aorta. We got this Doppler. Then we went for the apical 5. Jet is completely parallel to the cursor. There you can see. And we got this one, Doppler. Mean gradient 19. And so on, a little AI. A little, not a little, you tell me how much. Here another, this time 29. It went higher, better image, better window, a little. 29. Now let's go for the answer.